Greetings. I am Dr. Narasimhaiah Srinivasaiah. I am a colorectal surgeon. I work at Apollo Hospitals Bangalore. Anal cancer. To start with, the word cancer scares you. And when it is anal cancer, you are at a bit of a loss. What is anal cancer? Cancer is a growth that involves cells which are growing very rapidly, without control, abnormally. And when these cells are growing in the anal canal, involving the cells of the anal canal, it becomes an anal cancer. It can form a lump, it can bleed, it can spread, it can cause blockage. But why do people get anal cancers? One of the causes could be just the age. Age itself is a risk factor for anal cancers. In addition to other risk factors, we see the cells in the anal canal can also change in some conditions such as HIV, such as patients with transplant whose immune system is down with immunosuppressants. It could be related to what we call as human papilloma virus, HPV, which is a virus people acquire in the course of their life. So there are a number of reasons why people can get anal cancers. What are the symptoms? The symptoms could be significant itching, lump, warty lesions, bleeding, feeling lumps in the groins, or even anemia, which is lack of blood secondary to bleeding. When there is any problem related to the back passage, I think you ought to see a doctor who can talk to you, who can examine you, do the right investigations, take biopsies, confirm that it is anal cancer, and treat it. More often than not, if it is an early rectal cancer, the treatment involves radiotherapy and some chemotherapy. However, if the cancer is big, it may involve having a temporary bag, chemotherapy, radiotherapy, and an operation to remove this cancer, and occasionally to remove the whole of the back passage. So ladies and gentlemen, anal cancers are rare compared to colorectal cancers, but these are cancers which can be treated, which involves a combination of chemo, radio, and surgery. It is important to be aware of this, easily confused with problems related to hemorrhoids and warts, something to think about. One of the changes that the skin goes through is called as anal intraepithelial neoplasia, which is important, and when you see a clinician, they can pick up on that. So ladies and gentlemen, anal cancers are less common than colorectal cancers, seen in some sections of the population, and when there is problem with the back passage, please see a doctor who can attend to it, diagnose it, and cure it if it is picked up early. Thank you.